Morning, I'm Dr. Michael Anderson, Aurora Advanced Healthcare orthopedic surgeon, specialize in hip and knee reconstruction or replacement. Today we're going to talk about a wonderful gentleman that we replaced a hip on and see how he's doing in rehab. Greg Baker's a 64-year-old gentleman, retired insurance underwriter. Been dealing with arthritis of his hip for many years and had really formed quite significant destructive changes in arthritis of his left hip joint. Got to the point where he was really having pain, which was moderate to severe on a daily basis, and really starting to limit his activities. In general, he's a very active person, loves to participate in sports, especially softball and golf. I saw him last October, and these are his x-rays here. This would be sort of a more normal hip joint. This is his left hip, which shows severe destruction of the joint. You're seeing migration proximally or shortening of the leg, complete loss of the joint space, very big osteophytes around the hip area, so very, what we call end-stage destructive arthritis of his hip. On March 3rd, we underwent replacement of his hip, which was a surgical total replacement of his hip, and he's just done extremely well. His post-operative x-rays here that we have on the computer screen now show the replaced hip with the socket in the pelvic bone to reconstruct that, and then the new head, which is on the thigh piece that goes down the femur. We're able to get back a significant amount of his leg length difference as well with the reconstruction, and more importantly able to really get rid of his pain and really improve both his hip mobility and his function. So let's see how Greg's doing now in rehab.
I'm Greg from Wauwatosa, and I came out to Aurora to see Dr. Anderson because I needed him to look at my hip. And prior to my seeing Dr. Anderson, I was limping severely and in severe unrelenting pain. And when I got in to see Dr. Anderson, he took one look at me and he said, "You got in here just in time." And so we agreed to set up the surgery, and we had the surgery performed in March, and he did an outstanding job. And when everybody would ask me in the hospital or at physical therapy, "How's your pain?" I would have to think hard because of the fact that, gee, compared to having a pain level on 1 to 10 of 15 before the surgery, the pain level I couldn't even compare because there wasn't any compared to what I was dealing with, and it went down to probably a 1 or none. And Dr. Michael Anderson also said to me, "Gee, you're really a tough case here. Your leg length is over 2 inches different. I'll see what I can do to get you back." And when I woke up and he came in and saw me in the hospital, he said, "I think we got your leg length back," and he did. And I'm just so grateful for the fantastic doctor that he is, his positive, upbeat attitude, and then my being able to come here to Aurora's Physical Therapy Center out here in Germantown, which I wanted to do because Dr. Anderson is out here, and I think it's very important because they talk to the doctor, and they work together with the doctor to make sure that you're doing the right things in your physical therapy is in alignment with your surgery and the type of surgery you had done. And so I've been out here now for 9 physical therapies today, and from what they're telling me and from what I feel, I'm making great progress. I'm pretty much off the cane, walking well. Everybody who sees me says, "Wow, look at you." And I feel taller. After the surgery, I looked and I stood up straight after being over 2 inches shorter before, and it was just like seeing a whole different world.
Hi, I'm Ed Nazer, physical therapist from Aurora Advanced Rehabilitation in Germantown. Let's go into the gym and see how Greg's doing. He is a total hip replacement patient here at Aurora Advanced Rehab. He's not the typical total hip replacement patient that we would see, in that Greg wants to be able to get back to doing things he wants to do, like in softball and golf. So he thought that he needed a little bit more than just the usual run-of-the-mill rehab for hip replacement, which basically gets you back to functional motion. Greg wanted to get back to where he was able to play softball, able to golf, and we were able to do that with him coming here to Aurora Advanced. Let up. Okay, 2 more.
I can feel it more this time.
Good, Donna.
Now, thanks to Dr. Anderson's taking care of my left hip and doing a total left hip replacement, I've got my life back. And I'm so appreciative to what he's done, because now, starting the first week in July, I'm going to be able to go out there and play softball again, hitting, pitching, and enjoying the things that I love, especially playing softball 3 times a week and getting out and doing golf and maybe getting back into racquetball. And I just can't say enough for Dr. Anderson giving me my life back so I can also do things with my wife and we can enjoy things together that we couldn't because I was in so much pain and limping so terribly. Thank you again, Dr. Anderson, and thank you, Aurora.